Hello everyone, today we're going to talk about eyelid surgery. As we become older, our eyelids extend and the muscles that support them weaken. Many people express satisfaction with the result of blepharoplasties, such as a more rest and youthful appearance and more self-confidence. For some people, the result of surgery may last a lifetime. Aside from making you seem older, significantly dripping skin around your eyes impair your sight vision, particularly in the top and outside areas of your eyesight. After watching this video, you'll be able to understand everything related to eyelid surgery, such as how this procedure is performed, its benefit, and the expected result of this cosmetic surgery. Our role today is to answer most of your questions regarding eyelid surgery. Today we have Dr. Rhee, who is a leading doctor at Grand Plastic Surgery. He's going to discuss with us everything related to eyelid surgery from an experienced medical point of view. Hi, I'm Queenie, and before we start, please subscribe to our channel so next time you'll be updated with our new releases. So moving on to epicandoplasty, how do you find the perfect eyelid shape for your clients?
There are ideal shapes. The angle should not be too steep. A not too pronounced Mongolian fold. The eyes don't slant too much. Except for about an eighth. The eyes should be exposed. Usually, the aim of the surgery is to expose the eyes more and for the double eyelids. I help the patient choose together during simulations prior to the surgery. The patients are shown the results prior to the surgery. I show them the likely results and help them choose while looking with a mirror to compare. Thus, we arrive at the closest possible look that the patient wants.
Is there any difference between double eyelid surgery and upperblepharoplasty?
They're almost the same. Double eyelid surgery has both incisional and non-incisional methods. Even if there is incision involved, not a lot of skin is removed. The patients are younger people. As for upperblepharoplasty, it is typically for removing excessive upper folds for older people.
How do you resolve the aesthetic difference between yours and the client's?
I allow the patient to choose. Since it is the patient's own face, I tend to go the route that pleases them. In cases when the choices of the patient strays far from the normal standards, I try to convince them. In reality, I tend to follow what the patient wants. That is most important.
What would doctors do to solve unbalanced eyelids or pronounce the scars after surgery?
No one's perfectly balanced, but if the unbalance is the result of the surgery, then we must redo it to achieve the intended result. As for scars, often they fade after time. We can always fix it with laser surgery. But first, we try non-surgical methods. But in cases where the scars are persistent, we can fix them surgically. So how often do patients come to you or come to Korea after their first unsuccessful eyelid surgery? Lots and lots. At our hospital, like I said before, there are lots of patients who come to correct their prior eye, nose, face, breast surgeries. If someone flies all the way to Korea, it is often the case that the issues are not that simple. They would not come here for simple eye corrections. It is because they are clearly dissatisfied with the results, and I think they compromise about 80% of those who come to Korea for surgeries. For upperblepharoplasty, many who are older and have had prior surgery but want to have it done properly come here. Upperblepharoplasty represents about 30 to 40%, but for double eyelids it is about 80% who are dissatisfied and come for revision.
되게 많네요.
Yes, lots.
So is it difficult to redo the work from other doctors?
It is difficult. It is similar to treasure hunting until it is opened. We don't know. Because every person who has had different methods of surgery, after recovery the results may have varied, so the first surgery has to be to find the original shape. Sometimes it takes a long time just to do that.
So coming to our last question, is it possible to have epicandoplasty only on one eye when the other eye already has a double eyelid?
Actually, many patients ask that they have one eye with double eyelids and the other without, so they can only get surgery on one eye. In reality, the natural and surgery-made double eyelids differ slightly in depth. So if only one eye is done, there will be a difference in depth. So I recommend they do both eyes.
네, 알겠습니다.
네.
Thank you so much for today.
Thank you.
감사합니다.
네.
So today we learned many things about eyelid surgery, and the doctor explained in details everything related to this cosmetic surgery. Thank you for joining us today at CloudHospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.